Hi, I'm Jody Siegel. I'm Director of SOS Programming for Elyssa's Mission. We're a nonprofit organization. We're based in Northbrook, and our whole focus is suicide prevention. Specifically, we do suicide prevention in middle and high schools. The reason we got started is because of the young girl that you see in the photo here, Elyssa Myers, who unfortunately died by suicide in 2004 when she was just 16 years old. Elyssa had a lot of good things in her life. She was a good student. She had a lot of friends. She played sports. She played basketball. She wrote poetry. But Elyssa also had a diagnosis of depression. And as you may already know, and as I'll talk a lot about today, depression is much more than just being really sad. It's a serious illness that affects all parts of someone's life, and in some cases can even lead to thoughts of suicide. So this is why it is so critical that we talk about it. When Elyssa was in school, people were afraid to talk about suicide. They thought if you talked about it, it would somehow put the idea in someone's head. We know now that this is a myth and that school communities need to talk about it. So this is ultimately what prompted Elyssa's parents to start Elyssa's Mission shortly after her death. We fund and we help schools in Illinois implement an evidence-based suicide prevention program called Signs of Suicide, the SOS program. This is a program that we've brought now to over 275 schools. We're spanning 19 counties, over 115 suburbs, and growing each and every year. We have never turned a school in need away. We fund the program entirely and also help schools with on-site and off-site support. I'll tell you a little bit more about the SOS program later, as well as we'll be discussing your role in suicide prevention. At this time, I'm going to turn my camera off so I don't block any of the content in the upcoming slides. We all, we all know suicide is a concern. But to help provide some context for discussion today, I want to share just a few statistics. Suicide is the second leading cause of death for young people ages 10 to 24, with about 6,800 youth lives lost to suicide in the US in 2018. Suicides also are often unreported, so many so-called accidents are really in fact suicides. On top of this, it's estimated that for every completed suicide, there are at least 45 attempts, with an additional 250 people seriously thinking about ending their lives. So when you factor these last two items into the mix, then youth suicide becomes an even bigger concern than what the statistics reveal. But there is hope. 4 out of 5 people exhibit clear warning signs. People who die by suicide exhibit clear warning signs to family and friends prior to their death. So that's why it's so important to know what these signs are, to know what to look for, to know what to do when you're seeing them. And we'll be talking about that today. I want to start by talking about depression. And the reason for this is that depression is the leading risk factor for youth suicide. About 2.5% of children are depressed. Before adolescence, it's pretty equally split between girls and boys. And then beginning around age 13, about twice as many girls compared to boys have depression. About 10 to 15% of teens experience at least some symptoms of depression in any moment, and an additional 15.7% of teens, nearly 1 in 6, report experiencing at least one major depressive episode in a given year, and that is the most common type of depression. So there's a myth that teens can't become depressed, they're just moody. But as I just mentioned, nearly 1 in 6 experience real diagnosable depression. This is why it is so important, really so important, that all adults in teenagers' lives, teachers, parents, that you know the warning signs, that you know what they are, and you're able to help distinguish between typical adolescent behavior and behavior that warrants further investigation. So let's talk about what is typical. Most teens are starting to separate from their parents. They're spending more time with friends than family. Frequently, they're really concerned about appearance and how others perceive them. They are highly connected to technology, always on their phones or social media. Teens are also typically testing boundaries. They're experimenting with their identities. And then there's that moodiness, that irritability that at least most teens display, at least from time to time. And in many cases, it's directed at parents. But there's a big difference between that typical moodiness that most teens exhibit and then what constitutes a major depressive episode. And this, again, is the most common type of depression. So when we think of that word depression, most of us think of someone who is sad or really sad. And that makes sense. Feeling sad is one of the most common symptoms of the illness of depression. But there's a big difference between the two. We all get sad from time to time. Something happens in our lives to make us feel that way. We get in a fight with a friend or family member. Something doesn't work out in the way we were hoping or expecting. But sadness is temporary. It often goes away on its own. And there also are things that we can do to make it go away even faster. Watch a funny movie, for example, talk to a friend. Depression, on the other hand, won't just go away. It's an illness that affects all parts of someone's life. And as an illness, it requires treatment from a medical professional. So, in order for someone to get diagnosed with depression, and only a doctor can diagnose it, it's an illness, someone has to have 5 or more of the following symptoms. And these symptoms have to last for a 2-week period, as well as represent a change from someone's previous level of functioning. At least one of the symptoms must be depressed mood or loss of interest or pleasure. So, as I talk through these different symptoms, what constitutes a major depressive episode, it's not so important that you remember each and every one, that you memorize this list. The key, and really what I want to highlight here, is just the fact that depression affects all different areas of someone's life. It's more than just their mood. But that being said, as we look at the first symptom, that depressed, or notice it could also be irritable mood, that is definitely there. That's part of depression. That's why we think about someone who's sad when we think about that word depressed. But note that it's very pervasive. It's not someone who's just sad once in a while or irritable once in a while. It would be lasting really all day, or at least most of the day, almost every day for a period of 2 weeks or longer. And then that irritability, it wouldn't just be irritability directed at parents, for example, it would be really directed at everyone in someone's life. When someone has depression, we often see decreased interest or pleasure in all or almost all activities. Things that used to be fun stop being fun. So maybe your child used to really love to play a musical instrument like guitar, drums. Maybe there was a sport they were super engaged in. Maybe they loved playing video games or hanging out with their friends at the mall. So when someone has depression, they often will stop doing these activities that they used to really like to do. And there's no real good reason why they stop. When someone has depression, we often see eating or sleeping changes. Depression affects people physically. So sometimes it involves a loss of appetite. Someone's eating less than they normally do. Sometimes they eat more. We might see a weight loss or weight gain in a short period of time. Depression affects sleeping as well. So perhaps someone with depression is having problems sleeping at night. They're tossing and turning and not getting very much sleep at all. Or it could be that all they want to do is sleep and they're sleeping almost all the time, or well into the afternoon, and much more than even your typical teen who may like to sleep a little bit late. Along with this, we see change in activity level. We see fatigue or loss of energy. So when someone has depression, often doing even little things can make them feel exhausted. When someone's depressed, they often are really down on themselves. Their self-esteem is impacted. They feel worthless. They might make comments like, "I'm no good. I can't do anything right." So they're just really, really hard on themselves. Depression also affects someone's ability to think or to concentrate. So even making seemingly simple things like maintaining a conversation can be a challenge for someone who has depression. And then decision making. So decisions that might seem quite unimportant or really not a big deal, what clothes to wear, what plans to make over a weekend, that can feel overwhelming for someone who's depressed. And then lastly, those thoughts of suicidality, that definitely can emerge, especially if depression has gone on for a long time, and even more so if it's been going on untreated. An untreated depressive episode can last 7 to 9 months. So that's potentially an entire school year. So think about your teen, your child, and how much learning academically, socially, emotionally that happens in a given year. And now, knowing that depression affects all parts of someone's life, think how much they'll be impacted if they have depression and they are not getting treatment for it. It's also noteworthy that 90% of people who die by suicide have a diagnosable mental disorder, most commonly depression and or a substance abuse disorder at the time of their death. And it's a disorder that many times has not been diagnosed and or is not being treated. So logic speaks to the fact that if you want to prevent suicide, the best way to do this is to identify people with mental health concerns like depression as early as possible and get them linked to vital treatment and services. So the goal, especially for you as parents, is to identify warning signs for depression as early as possible and not wait until your child has full-blown depression before seeking help. So as a parent, here are some of those incipient signs that you should be alert to, that you can look out for. So we already talked about the fact that depression affects mood. So you might see a lot of crying. Your child might seem really sad. You might also see irritability and anger and grouchiness, and it could be a combination of the two. So with Elyssa, it was, really both. Sometimes she was really sad and down, and other times just a lot of anger and irritability. So those mood changes. Someone who has depression, you might notice that your child, for example, is starting to withdraw, and not just from you as parents, and not just part as the normal part of growing up and spending more time with friends instead of parents. This will be withdrawing from family, as well as friends, as well as regular activities. So if this starts to happen, that definitely could be an early sign. Alcohol and drug use. So we know that many teens may experiment with drugs and alcohol, and certainly you should talk to your child about the dangers of even experimentation. But particular red flags to look for with regard to depression is if your teen is using drugs or alcohol alone during the day, or to cope with how they are feeling. So this is much more serious than if, for example, they try one beer at a party one time, so it's kind of putting things in perspective. Risk-taking behaviors. So your child might start to engage in risky behaviors, putting themselves in dangerous situations on purpose. So for example, picking fights, climbing too high on playground equipment, shoplifting, vandalism, getting into cars with people who've been drinking, being promiscuous. Depression, as I mentioned earlier, can affect someone physically. It affects eating and sleeping, for example. It can also bring on physical symptoms. So if your child is suddenly complaining a lot about headaches, stomach aches, especially if they're not sick and you take their temperature and there's nothing technically wrong, they don't want to go to school, they don't feel good, that could be a sign of depression. And then speaking of school, poor school performance definitely is something that is really, really typical, and a good thing to take seriously if you're noticing this in your child, because it could be a possible sign of depression. So it could be real blatant signs like your child suddenly goes from A's to C's. It could be that they stop doing their homework. It could be that the school is calling you because of constant issues academically, behaviorally, socially. But it could be more subtle changes. So maybe your child just isn't spending as much time on work as they used to. They don't seem as engaged in school. They don't seem excited about learning like they used to. So those are all important signs to keep in mind. And then the last one, a marked personality change. If your teen just doesn't seem like himself or herself, that could also be a sign. So we've been talking a lot about depression. The reason, once again, is that depression is the leading risk factor for suicide. But risk factors are not causes. Whenever there is a suicide, the first question people ask is why? And the natural question to ask is why? Why did this happen? How could this happen? What is the reason? But very rarely, however, can suicide be attributed to just any one thing. In most cases, it's the result of a combination of different risk factors in the presence of one or more precipitating life events. So a risk factor is really anything in someone's personality or in their environment that's associated with suicide. And a precipitating event, that's that trigger that we often hear about in the media, for example, when they're trying to pinpoint that so-called reason why someone took their life, saying that they did it perhaps because they were bullied at school, or because they had gotten suspended for a fight or some other serious situation. Yes, certainly those situations, those triggers play a part, and they might be kind of the straw that broke the camel's back, but very rarely are they the sole reason. Almost always there are underlying risk factors that are present. So before I talk about some of the specific risk factors for youth suicide, I want to first point out that all teens are at increased risk for suicide compared to adults due to the status of development of the teenage brain. So as you may know, the brain doesn't fully develop until someone is in their mid to late 20s, and the last part of the brain to mature is the frontal lobe. This is the part of the brain that's responsible for rational thinking, for controlling impulses, and for planning ahead. So as a result, teens can't think through problems in a complex way. They're impulsive, they're focused on the here and now. So this is why something like a breakup, a bad grade on a test, a falling out with friends can be such a big deal to them. They're not able to think through the fact that they'll have other relationships, that they'll do better on the next test if they study, that their friends will get over it. They are only able to think about how they feel in that moment. So when you couple this normal teenage brain development with someone who also has depression, it makes it more understandable why suicide could seem to be a viable solution to a problem. So this list of risk factors here by no means is exhaustive. It's merely a sampling of some of the many risk factors that could influence someone to take their life. And as we talk through these, just keep in mind the more risk factors someone has, the greater the likelihood that they potentially could make a suicide attempt. So it's important to have an understanding of these risk factors. If you are noticing that, you can check off many of these with regard to your own teen, then you'd want to be that much more watchful for possible signs of depression and or suicide. So the first three that are listed, depression, alcohol and substance abuse, previous suicide attempts, these are the three leading risk factors for youth suicide. Self-injury is another significant one. And when someone is doing this, it's not, as many people may think, it's not that they're trying to kill themselves. And some teens even say they self-injure as a way to stop themselves from a suicide attempt. So self-injury is basically is when someone's hurting themselves on purpose. So most commonly, this is through cutting. It can also be burning, scratching, really anything they're doing to injure themselves. And teens who do this say that the reason is it's helping them to process and deal with some very difficult emotions. And clearly, this is an ineffective means of coping. It's very dangerous. Someone who's doing this could accidentally injure themselves very seriously, and this behavior certainly is a risk factor for suicide down the road. So if you're seeing these kind of behaviors in your child, you want to seek help and treatment right away. About 1 in 4 teen girls report self-injury in the past year, and 1 in 10 boys, for an overall prevalence of about 18%. The good news is this behavior does decline as teens get older. Anxiety. So anxiety disorders, we hear a lot about this. Especially heard a lot about this during the time of the pandemic. Most of us felt this way. But with regard to anxiety disorders, they are actually common mental illnesses. They're characterized by feelings of uneasiness, worry, and fear. And a person with anxiety experiences much more anxiety and worry than would be expected in a given situation. It's important to note that there's a strong correlation between anxiety and depression. Nearly half of those diagnosed with depression also have an anxiety disorder. So if you're seeing signs of anxiety in your child, especially if it's interfering with their daily life, with relationships, with schoolwork, etc., it's really important to address this issue and to seek treatment really right away, because you want to avoid it turning into depression and becoming an even more significant risk factor for suicide down the road. Someone's personality can also influence the risk for suicide. So a teen who has poor self-esteem, poor problem-solving skills, who's impulsive, who's aggressive, who's socially isolated, they can be at increased risk for suicide. Negative life experiences. So if something bad has happened in someone's life, either currently or in their past, definitely it's going to influence their risk. So it could be that a teen is excessively bullied. This could be online. This could be in person. This could be both. It could be that a teen has lost someone close to them. A family member, for example, has passed away. Sexual assault, some kind of trauma, some kind of horrible accident. The list goes on. And I just want to pause for a minute to remind you, the more risk factors someone has, the greater the likelihood they could be at risk for depression as well as suicide. And with regard to Elyssa, for example, she unfortunately experienced something really traumatic. She was sexually assaulted by a family friend when she was quite young. On top of this, she was bullied a lot. She had, and as part of the sexual assault, she was diagnosed with PTSD and later depression. There was some self-injury with Elyssa. She was trying to deal with some of the very difficult emotions and feelings that she was having. So a lot of things going on here. So again, the more risk factors that are present, the more watchful you want to be of your teen, of your child. Just to kind of point out a few more, family history of mental health disorders, as well as suicide attempts, can also be a risk factor for suicide. Family stressors. So think about things in your lives that are stressful for you as parents. So if you're going through a separation, a divorce, if there are financial struggles in the household, if there's a family member who's incarcerated, if you as parents are taking care of one of your elderly parents, and that can cause a lot of stress, especially if they're living in the home with you. So all these different things, think about how stressful they are for you, and now think about the impact they could have on your teen. So if there's something going on in your household right now, it's definitely it's a time to be that much more aware of and on the looking for possible signs. Stigma, just briefly, this is basically the belief that that mental illness, it's something that deters someone from seeking help. The belief that if you seek help for a mental illness, it might mean that you're weak, maybe that you're crazy. So if parents are in denial of their child's mental illness, or there is this stigma that is stopping them from getting the critical help that their child needs, and their child is going to be that much more at risk for possible suicide. And then lastly, access to lethal means. So firearms, I just want to point out that guns are actually involved in over half of all suicides. They are the most lethal. And if there are guns in the home, they increase the risk of suicide, whether someone has a mental disorder or not. And excessive alcohol use can contribute to this. So remember, teens in general are impulsive. So sometimes, even if there are not risk factors that are present or minimal risk factors, if something really bad happens to them at school, for example, they come home, they're really upset, and they know there's a gun in the home. Sometimes that alone, that access can be enough. So you want to keep your home as safe as possible. Ideally, if you do have guns in the home, then they're going to be locked. Ammunition will be locked in a separate cabinet. But especially if you are concerned about your child's mental health, the best thing to do is to remove firearms from the home. And the other thing besides guns, which I know many of us don't have guns in the home, but there are other means of self-harm. So pills, for example, a lot of prescriptions, alcohol. So keeping your home as safe as possible, removing as much of that as possible, or putting it in places where your teen does not have access. So removing that access can help reduce suicide risk. So there's one other risk factor that's pretty significant that I wanted to highlight. So teens who identify as lesbian, gay, bisexual, transgender, queer questioning, intersex, asexual, the plus is basically any other way someone might identify outside of the typical norm or so-called norm. Teens who identify in this way are 4 times as likely to attempt suicide compared to their peers. And if they've come out to friends and family and they're not accepted, they are 8 times as likely to attempt suicide. So this is really, really significant. Also, LGBTQIA plus youth are at increased risk for eating disorders, for dating violence, sexual assault, drug and alcohol abuse, things that in and of themselves are risk factors for suicide. There's a study that came out very recently looking at the impact of the pandemic on LGBTQIA youth on their mental health. And I just wanted to share this because I think it's pretty revealing. About 35,000 youth were surveyed. 42% reported that they seriously considered suicide during the past year. And this percentage climbed to over 50% for those teens who identified as transgender or non-binary. And then 70% of LGBTQIA plus youth reported their mental health was poor either most of the time or always during the pandemic. So this is pretty significant, but there are some glimmers of hope here. So transgender and non-binary teens who reported having their preferred name and pronoun respected by everyone in the home, they attempted suicide at half the rate as those who didn't have their names or pronouns respected by anyone they lived with. Also, transgender and non-binary teens were able to change their names and or their gender markers on legal documents, or even if not legally in the school and on all the school paperwork, they reported lower rates of suicide attempts. And finally, LGBTQIA plus youth with access to spaces that affirm their sexual orientation and or gender identity reported lower rates of suicide attempts as well. So having spaces where they feel accepted. So in terms of implications for you as parents, if you suspect that your child is struggling with their identity, with their or gender orientation, with their sexual orientation, or if they've come out to you, the best thing you can do is accept them. Respect if they want to be called by a different pronoun, if they want to be called by a different name, and do your best to accommodate that and to show that you accept them and love them no matter what. Even if you disapprove, even if you think it might just be a phase, it's so important they have this acceptance. And this also includes advocating for your child if there's issues at school, if there's any bullying problems, if the school is not adhering to, if it's a transgender child, for example, and they're not adhering to your child's preferred name and pronouns, you need to stand up for them at school and the community as well. So I want to briefly share this brief video clip. So this is a clip of Elyssa. And remember, Elyssa is why Elyssa's mission got started. It's why we do the work that we do. And this clip of Elyssa actually initially appeared in the Signs of Suicide program, the national program that we bring to schools. Even though we didn't develop this program, it was developed by an organization in Massachusetts. We work really closely with them as an organization. So when this organization was updating the high school video at the time, they asked Elyssa's parents to share her story. So the video has since been updated once again. So Elyssa's story no longer is part of the SOS program, but I think it's still very, very pertinent. And I want to show it to you because it provides context for why we do the work that we do at Elyssa's mission, why we know in our hearts it is how important it is and how needed it is. And this video clip, you will also hear, through this clip, you will also hear some of the risk factors for suicide that we just talked about. They'll kind of come out. You'll also see some of the signs of depression that we've talked about, and also some of the critical signs of suicide that were present with Elyssa will also be revealed, and we're going to talk about that next.
Warning signs prior to her being diagnosed with depression. She acted out. She had a lot of anger in her to the point where it was just not normal behavior. Making poor decisions and choices, compromising herself and her safety. And all of these were warning signs.
She was clearly depressed and down, and she was sad a lot of crying.
I'll never forget this. When I walked into the door of her English classroom, the teacher had all the writings up on the wall, and Elyssa the title of her paper was "My Life Makes Me Want to Cry." So these were all warning signs.
In 7th grade, Elyssa would verbalize to me that she wanted to end her life, and she would show me the cuts on her wrists and would, ask me if I would attend her funeral if she did kill herself. She would say, "I want to kill myself. I just want this to be over." Things like that. We were so young, and I had never heard anyone talk like that before, and obviously I took it seriously, but I was young enough that, it was hard to know what to do and what to say to her and who to talk to.
So clearly, having this education for teens is critical. Elyssa's friends, you heard them talk about the fact that they knew something was wrong with Elyssa, but they didn't know how serious it was. They didn't have education about the signs of depression, the signs of suicide. And Elyssa would make them promise not to tell anybody. They wanted to be good friends, so they kept what they were seeing a secret. And as you can imagine, they felt and still feel even today a lot of guilt and regret that they didn't tell an adult. And it's not their fault, of course not. But it's really important that we are getting this messaging out there. And so I just want to highlight for you as parents, just like we want to educate teens, we want to make sure that you also are aware of all these signs, which is why we're talking through all this today. And thank you again for joining us. But these critical signs of suicide are really significant. So I spoke earlier about signs of depression. And remember, for someone to get a diagnosis of depression, they're exhibiting 5 or more different symptoms over a period of 2 weeks or longer. So, there's a pattern of behavior. But with these signs of suicide on this slide, even if you're only seeing one of them, even if it only happens once, it's that important that you need to seek help for your child immediately because they could be at imminent risk for suicide. So the most significant sign is when someone talks or writes about suicide or death. This could be someone saying, I want to kill myself. I want this to be over. Things like Elyssa said. It could be indirect statements like, my family would be better off without me, or pretty soon you won't have to worry about me much more. This could be something that someone says. It could be something that they write in an email, in a text message, a social media post. Alyssa's mom spoke about Alyssa's paper, My Life Makes Me Want to Cry. So something that's written in a school assignment is another reason that another way this could come out. Other critical signs, someone who drops out of school or other activities, and again, for no apparent reason. Someone who is isolating themselves from everyone and everything in their lives. Someone who is neglecting their appearance or their hygiene. And most teens, they're pretty concerned about how they look. Not all, but most. So especially if this is a change from your child's previous behavior, they used to shower every day, take care of themselves, and care about what they look like. Suddenly, they stop showering, they're not brushing their hair, they just don't seem to care. That could be really, really critical as a sign for suicide. Someone who obtains a weapon or other means of self-harm. It could also look like someone researching ways to end their life. Someone giving away prized possessions. So in the weeks before Elyssa died, she started giving away her clothes and her jewelry to her friends. And they just thought Elyssa was being really generous. They didn't know that this was actually a very serious sign. Adults have ways of tying up loose ends. They have formalized ways. So it could be for an adult, maybe they're going to go get their will in order. For a teen who's thinking about suicide, they don't have this formalized means of tying up all their loose ends. So it might look like apologizing for wrongs that they have done. There's a middle school we work with where a student put goodbye notes in all her friends' lockers. So saying goodbye. And in this case, luckily, her friends knew to come forward and she was able to get help. There's a high school we work with where I was at the school when this happened, where a student came forward that he showed a text that he had received from a friend to his counselor. And the text was really serious. That it really, it basically said, I can't do this anymore. I want to die. And the student who wrote the text had provided his computer passwords and gave directions about who should receive his things. So obviously the school took this really, really seriously, as they should. This was a critical sign. They ended up calling, the student was not at school. The student who wrote this was not at school that day. So they called his parents. Parents were at work. They ended up dispatching police and ambulance to the boy's home. And luckily he was okay, but he did have a plan to take his life that day. So again, you need to react really strongly and immediately if you're seeing any of these here. Lastly, a sudden unexplained improvement in mood after a period of time of being really down and withdrawn, for example. So sudden mood shifts, even if it's from negative to positive, might not be a positive thing. So often people who are contemplating suicide, it's not that they want to die, it's that they want to end the extreme pain that they're going through. And teens in this situation often have tunnel vision. They see no way out. It's black or white thinking, and the only way to end this pain is through suicide. So if they get to the point where they make a plan, they have a way in their minds to end this pain, it might come across as renewed energy, even happiness. And that's why this last sign can be significant. So we talked earlier about risk factors for suicide. And as you may recall, these are things that increase someone's risk. The more risk factors someone has, the greater the likelihood they might make a suicide attempt. So protective factors are kind of the opposite. They are mitigating factors that even in the face of risk factors, if these protective factors are present, they can help reduce someone's risk for a suicide attempt. So as I spoke about earlier, someone's personality can increase their risk if they're impulsive, if they're aggressive, if they're a poor problem solver, if they have poor self-esteem, poor social skills. So on the flip side, someone who has good social skills, who has good self-esteem, who seeks help when they need it, who is open to new ideas and new knowledge, they will likely be at a reduced risk for suicide. In terms of relationships in the home, it's so important for kids, for teens to have healthy, loving, supportive relationships with family members. Family connectedness is actually the number one protective factor against suicidal behavior. So even if things aren't going well at school for a teen, they might feel like they don't fit in, maybe they're not getting good grades. If they can come home to a loving and supportive environment, it can really act as a buffer and a protective factor against suicidal behavior. I talked earlier about the impact of LGBTQIA plus teens who don't have acceptance from parents and how much that lack of acceptance elevates their risk. So having acceptance from parents, from other family members, really for all teens is so important. And then in terms of connectedness in the school and in the community, the more enmeshed a teen is in different activities, clubs, sports, extracurriculars, in school, if they're involved in the community, in their a religious association, for example, the more connections that they have, the more activities they're involved with, the more opportunities to interact with other youth, with other adults, that can serve as a significant protective factor for youth. So we talked about protective factors. I want to talk now about the steps that you are already taking and can continue to build upon as parents to help keep your teen safe and reduce the risk for suicidal behavior. We all know how important it is to have regular check-ins with our children, but we're busy. We may have multiple jobs. We often have multiple children. There are errands to get done. There's just never enough hours in the day as it is. And our teens are really busy too. They're busy with friends, they're busy with extracurriculars, sports, homework. Sometimes we barely even see our children. It might just be for that brief time at the dinner table before the kids run off to go do homework or watch TV or go back to their phones. So we often don't have a lot of time to do these check-ins, but we need to build them in even briefly. And sometimes the best place to do this is in the car, for example. So you're picking your teen up from somewhere and they don't have to look at you while you're driving. You're facing the road, whether they're next to you or in the back seat, you can avoid eye contact, and that can be more comfortable for them. Sometimes we stop asking our teens about school or about their day because we anticipate in getting those one-word answers. Good, fine. And that may very well be all that we get, but we still need to ask. Teens acknowledge when we are asking these questions. It lets them know that we care, and it's important to them, even if they don't show it. It's important to not just check in with your teen, but to know how they're spending their time, especially if they're spending a lot of time at a certain friend's house. You want to know that friend. You want to try and at least have some contact with those parents to make sure that where they are going is a safe and supportive environment. Monitoring schoolwork. So as we know, you heard the example in the video Elyssa's mom shared about. She walks into Elyssa's English class, and on the wall she sees her essay, "My life makes me want to cry." So a lot of times signs of depression and suicide can come out in schoolwork, whether it's a writing assignment, whether it's a drawing, whatever the case might be. So especially if you're concerned about your child, if they're acting differently, for example, it's okay to look at their personal materials. It's okay to look through their notebooks, their homework, their backpacks. They might not like it, but this can really give you some good insight into what's going on. Teachers receive a lot more training now than they did when Elyssa was in school regarding different signs to look for, and teachers know to report these different things to mental health staff in the building right away. But that being said, we want to have as many eyes kind of on the lookout for these things as possible. So as a parent, you want to be looking for themes of death, hopelessness, despair in any writing, drawing, etc. that your teen might be doing. Internet safety and social media use, we could do a whole training on these topics alone. So briefly, as parents, we want to be aware of what our teens are doing online as well as monitoring their usage. NetSmarts, and Smarts is with a TZ, netsmarts.org. That's one website that provides tips on internet safety as well as discussion starters for parents. So that might be helpful to check out. And with regard to social media, just know there is a correlation between social media use and depression. So the more time your teen spends on social media, the greater the likelihood there is of them becoming depressed. And there also is an inverse relationship between social media use and sleep. The more time on social media, the less sleep they're likely getting, which in turn affects mental health. So as parents, minimally, we want to know what apps our teens are using. And as I mentioned earlier, trying as much as possible to limit their time on these different apps. So as parents, you're paying the phone bill, you probably bought the phone. And so you have a right to look at your child's phone from time to time. And that doesn't mean you should be reading all their texts or looking at all their posts. That's not only invasive, but it's unrealistic. We don't have time to do that. But you can and should look at their phones from time to time and let your teens know you're going to be doing this. So that way you can make sure they're being safe themselves and whatever it is they're posting. You can also see what others are writing to and about them. And if your child knows that you're going to be doing this occasionally, they're going to be that much more cognizant of what it is that they're posting on social media, of what text they're sending, all that kind of stuff. And thereby they'll be safer. So limiting usage, this is probably even more challenging. And as a parent of two teens, I know how challenging it is. But you don't want them on their phones half of the day or more, which they very well could be if you didn't have any intervention in this. So perhaps a good rule of thumb is to have a cutoff time each night. So maybe 9 o'clock, for example, when they can charge their phone for the night in the kitchen, for example, and not have it in their rooms. They may tell you, oh, it's my alarm clock. And I solved this problem for my kids because I bought them alarm clocks and they don't need their phones now in their rooms. So, something just to think about. Removing lethal means from the home. We've talked about that earlier. This next one. So think about if another parent had information about your child, just like other parents had information about Elyssa and some of Alyssa's friends, it was discovered later, had even told their parents about their concerns with Elyssa. But sometimes as parents, people feel, oh, it's not my business, it's not my place, it's really uncomfortable. I don't want to talk to another parent about their kid. But wouldn't you want to know if other parents had information about your child? So in the event your child confides something to you about a friend of theirs, or if they have a friend over at your house and you observe something that's concerning, however you get the information, if you have some information that you feel another parent should know, the recommendation is that you try and talk to them about it. They may get mad, they may get defensive. Those are natural responses. And the best you can do in that situation is just to try to stay calm and just convey to them that, that this is something you're seeing and you feel it's important that they know. So if it's an emergency situation, you really want to call this parent right away. If they hang up on you or they tell you, no, that's not true, or mind your own business. If it's something that serious, like someone talking about suicide, in that case, you may need to call 911 and have them do a wellness check on that child. Think about safety first. If it's a non-emergent situation, maybe they just seem really sad or down, maybe not suicidal, but you're thinking there might be some depression or anxiety. Yes, you certainly can call the other parent, and that's, if you have a relationship with them, that's the best thing to do. But another option in that situation is to call the school, ask to speak to the social worker, the counselor, and report your concerns. And they can then follow up with that child and then with that parent. And you'd be out of the mix. They would not, come back to you and give you and tell you what happened. That would breach confidentiality, but they could then follow up with the child. So it's a way to kind of help make sure they're safe. Just lastly, proactively, in terms of kind of keeping your child safe, if you see something that worries you, don't wait. If you're wrong, but best to check it out. So in terms of talking to your child, I talked about having those regular check-ins and how important they are, even if you're not observing signs of depression and or suicide. But that being said, if you are observing signs, it's even more critical that you talk to your child about your concerns. And they might not want to talk to you. And if it's not an emergency, don't force the issue. If they say, leave me alone, or they change the subject or they walk away, then that is okay. And just let them know, maybe we'll talk later or try again later. Don't just try once and give up. It might be something that you have to attempt multiple times before they finally will talk to you. But when you're having these, and if it's an emergency, by the way, you would be taking them probably to, a hospital or, somewhere to get an assessment. So this wouldn't be as significant. So non-emergent situations, that's where it's okay to wait. But in general, when you want to have conversations with your child to discuss concerns, it's best to do this in private. So make sure you're away from siblings, make sure your phones are off. Also, mentally prepare yourself for the conversation and remember to remain calm, because if your emotions escalate, imagine how your teen's going to react. And then the conversation is going to just end there, then and there. Listen, or first, before listening, be calm and supportive. And then next, listen without interrupting, listen without overreacting. As parents, we often want to try and fix things. Sometimes the best things that we can do is just listen and let your child talk. Expressing concern and caring, let them know the warning signs that you're seeing in them. So you might say, I've been seeing you cry a lot more lately. You're not hanging out with your friends as much. You just seem really unhappy. I'm worried about you. So telling them what you're seeing and why you're concerned. Asking directly about suicide. So please know it is okay. Not only is it okay, it's recommended to be direct with your child. So if you think that they might be having suicidal thoughts, then you want to broach that with them. It's going to let them know that this is something that is okay to talk about and that you care and that you're a safe person they can talk to about these potential thoughts and feelings. So directly. So are you thinking about killing yourself? Are you thinking about suicide? So as direct as you possibly can be, and really reassuring your child, whatever the situation is, that help is available and your job as a parent is to keep them safe. So in terms of some conversation starters, really the best thing to do is just to keep it simple, to state the concerns that you're seeing and to let your child know you care and want to help. So I statements. I've noticed that, I'm sensing that. You could phrase it as, lately, I've noticed that you seem really down, distant, upset. Can we talk about that? I want to help you to feel better. Your child might tell you something that doesn't seem to be a big deal in the grand scheme of things. So teens often are quite egocentric, and remember, what's a big deal to them is really to us something often very trivial. But we want to respect kind of where they're coming from. So maybe they're telling you about how a friend was mean to them or they weren't included in some type of plan. And in the grand scheme of things, big deal. But to them, it is a big deal. So you don't want to make comments like, oh, don't worry about that, or you other friends, or just ignore it, because that's not conveying to them that you really understand them and that you are concerned and that you care. And along the same lines, if your child tells you that they've had thoughts of suicide, it's normal to be frightened, and a knee-jerk reaction could be to say, oh, how could you feel that way? I give you so much, or you have so much going for you. So in that situation, you want to avoid minimizing as well, and reassuring your child that they can get help and they're not going to feel this way forever. So your role is, in terms of helping your child, not to provide advice or try to fix the problem, expressing caring and concern and letting them know that you want to get them some help. So speaking of help and treatment, if you're having concerns about your child, then when is it the time to seek treatment for them? So if you're observing any suicidal thoughts, behaviors, or talk, any of those critical signs of suicide that I discussed a few minutes ago, you need to seek help immediately. But in other cases, really the good rule of thumb is to seek help when other signs are lasting for 2 weeks or more, and or when mood or behavior is interfering with your teen's ability to function. because this could indicate possible depression. That being said, your child doesn't have to be clinically depressed or have a mental health disorder like depression or anxiety to warrant mental health treatment. So there are lots of reasons why you might want to seek counseling or therapy for your child or for your family. Maybe you're, like we talked about some of those stressors earlier. So there's a separation or divorce that's going on. Maybe there was a loss, grandma passed away and your child's really having a difficult time with that. Maybe they're having problems managing their anger. So there are lots of reasons to seek therapy. But in terms of depression, talk therapy is really kind of the first step. And there are lots of types of therapy, by the way, cognitive behavioral, there's art therapy, there's play therapy, there's a whole bunch of different types. So really it's important if you are seeking therapy or counseling that you know that the first person you meet or reach out to might not be a good match. So you're going to want to try and be patient until there is a good match and it's someone that your child will actually talk to. Medication is really the other primary way that depression is treated. So in large scale randomized studies, there's been a lot on that. There's been the studies have been done on adolescent depression, I'm sorry. Medication does show a clinically statistic effect. So there's a lot of evidence showing the efficacy of medication. And in fact, it really is the standard of care for moderate to severe depression. And the best results in terms of treating depression are when therapy is combined with medication. That being said, if your child is on medication and needs to be monitored, it needs to be monitored by you, by them, by the prescribing physician or psychiatrist. You need to be looking for possible side effects, and you want to make sure that the positive effects that you're hoping for are occurring. So it does take time for medication to build up in the body. It takes usually a couple weeks before you can know for sure if something is potentially working. But after that point, you really, if you're not seeing the results you need, you might need to be, or there's some side effects, you might need to switch medication. So talking to your child's doctor about that. In addition to therapy and medication, there's other interventions that you as parents can really help kind of get into play. So we talked earlier about how sleep, eating, and activity level are all impacted when one is depressed. So the more that you can do as a parent to bolster healthy habits in these areas, and the more you can encourage adequate sleep and healthy diet, the better. So we talked about taking the phone away at a certain point at night, setting a regular bedtime, ensuring as much as possible that your teen is eating at regular meal times, not skipping meals, that they're exercising. So all that you can do to encourage that is really, really helpful. And then hospitalization, this is a possible treatment for depression, especially if someone is at the point where they're thinking of suicidal behaviors. So usually hospitalization is only used as a treatment intervention if their safety is in danger, if they've made a suicide attempt, if they have a plan, if they are verbally stating that they are going to end their life. So they would need to be assessed by a professional to determine if this is the best placement for them. There's different types of hospitalization. There's the inpatient, but there's also partial programs where they would go during the school day, or intensive outpatient programs where they would go maybe daily after school from like 4 to 7, for example. So there's a whole range of what this could look like. So in terms of where to go, like finding a therapist, for example, or if you do think you need that hospital assessment, then what do you do? So in terms of finding a clinician, really a great place to start is going to your child's pediatrician or physician, and for the family, it could be calling the school. So the social worker, counselor, psychologist, nurse, they often have a lot of referral options that they can inform you about. And even kind of letting you know with your insurance, like which would be the best placement. You can talk to neighbors, you can talk to friends, you can talk to someone at your church or temple. So there's a lot of different people you can speak to. And in talking to others, you will likely find that you are by far not alone in terms of seeking help for a mental health condition. So this is a common thing. And so not being afraid to talk about it is going to help you that much more to know you're not alone and to figure out where to go. The suicide prevention hotline number is a great resource too. It's 24 hours a day. You can call, you can text, it's anonymous. In the event your child is suicidal. So in the moment, if you could call 911 if you worry about you're being able to get them somewhere to get assessed. If you're worried about their safety, your safety. If they've made a suicide attempt, for example, or they've harmed themselves in some way, going to the nearest emergency room is your best bet. But if it's more that you just want to find out if they're safe, maybe they've made a comment about wanting to die, or you're noticing some of those other critical signs of suicide, but their physical health is not in danger, the best place to go to in that case is a behavioral health hospital. So this is, you'll have less waiting time in this situation compared to a typical hospital. And they really are trained. So at behavioral health hospitals, they can do what's called a level of care assessment on your child, where professionals will actually assess what they need in terms of treatment. So it's and it's free. So you can walk into any of these. They're open all the time. And our website, Alyssa's Mission's website, lists a number of behavioral health hospitals where you can go for this type of assessment. So when it comes time to set up, or I'm sorry, if you have mixed feelings about, sorry again. So it's time for you as a parent, you're considering if your child needs some help. If you need to make that intake appointment, if it's a non-emergency situation, for example, it's normal as a parent to feel intimidated and to have mixed feelings. You want your teen to be okay, and you may find yourself coming up with reasons why they don't need treatment after all. So the following are some of the most common objections that parents have to seeking treatment for their teen's mental illness, as well as the reasons why they would need to seek help anyway. So you might say, I'll wait until they outgrow this phase. But if your child has depression, they need medical attention. It's not going to just go away. You might think to yourself, I don't want to label my child. Well, would you worry about that if your child had a physical illness? You might think, oh, my teen refuses to see someone, or they're going to be mad at me. Your child's objection would not stop you from taking them to the doctor if they had a physical condition, if they had diabetes, if they were exhibiting signs of asthma. That you're not going to stop yourself, or that's not going to stop you from taking them. Your teen's reactions are not going to stop you. So you need to keep that in mind for mental health issues as well. You might think, I don't know where to go. There are lots of places, and I just spoke about this, talking to your child's counselor, your child's physician, friends, family. You might think, I don't want my child to take medication. I heard it's dangerous, has side effects, and hasn't been tested. Antidepressant medications, as I just discussed, they have been tested, and they are known to be safe in teens. You need to monitor for different side effects and for positive effects, but if medication is the best route and it's needed, at least you can know as a parent that it is safe. So if you have mixed feelings about seeking treatment, you can only imagine how your teen will feel. They will likely be scared, especially if they don't know what to expect, and that fear might come across as resistance or anger. So it's important to respond to their concerns in a calm and straightforward way. So if your teen says, I can handle this myself, or this is going to go away by itself, then you should respond, what you are dealing with is a medical condition. You need attention from a doctor. It's not going to just go away. Your teen might say, I'm not crazy, and you want to affirm that, but also letting them know, you're not crazy, but you do have a medical condition that needs treatment, and it can be treated so that you can feel better. They might say, I don't want to be locked up in the hospital, letting them know that most people with depression don't need to go to the hospital. There are lots of ways to treat depression, and we're going to look into that. They might say, I don't want to take medication, letting them know, we don't know if medications are needed for you, but the goal is that we want you to feel better. And in the event the doctor recommends medication, they are safe and they will help you. Lastly, you might think, I don't want to talk about this, or they might say, I don't want to talk about this. And what you need to say in that situation, I understand that you are uncomfortable, but it's my job to keep you safe and healthy and to get you the help and treatment that you need and deserve. So I want to just conclude in these last couple slides by very briefly just talking about the signs of suicide, the SOS program that we bring into schools. So maybe your child's school already uses this program, and that's how you know about Elyssa's mission. And you certainly can and should talk to staff at the school as well as your child about the program. Or maybe you're not sure if your child's school uses the program. So just to give you an overview, basically SOS, the reason Elyssa's mission selected this particular program, the reason we've been funding it and supporting schools with implementation for over 11, 12 years now, really SOS is the only suicide program out there that actually is shown to reduce suicide attempts. So we know that schools, if they're going to bring a program in, it needs to be a program backed by research, a program that has safe messaging and that is shown to be safe for teens, a program that's going to do what it says it's going to do. So this program really does this. It increases students' knowledge and adaptive attitudes about help seeking. And in terms of the research shows that 64% of youth who go through the program are reporting, or they're actually seeing 64% fewer suicide attempts for those youth who go through the SOS program compared to those who don't. The program itself involves education and screening. So through a video and discussion that can happen in just one class period, students are learning about warning signs for depression and suicide, and they're learning what their role is if they're observing these signs in themselves or someone else. But the other really, really important part of SOS and what distinguishes it from other programs that are out there is the screening component. So students fill out a 7-question yes or no screener. You see it right in front of you. It's a short 1-pager. We frame it to them as a survey. And these 7 questions in no way diagnose anyone with depression or suicidal behavior. It's a way to alert school mental health staff to those students who need further investigation. So if students answer yes to multiple questions or to certain questions that are triggering, for example, the questions asking them if they think about suicide, or if they've ever made an attempt, then it's important that someone talks to them about this and gets more information. So this happens in a confidential, private way with trained school mental health staff. And in the event from that interview, it was revealed that students need help and support or additional assessment, then certainly that will be recommended to parents. But all students who receive follow-up, parents are notified. And note that as part of this screener, students also have the opportunity to indicate if they want to talk to someone at school. And this could be about themselves or a friend. So most students will say no if it's about themselves. A lot of times, the only time students check yes is because they want to report information about a friend, and we want them to have that opportunity to do that. Most of the time, students, even if they are seriously at risk for depression and or suicide, they'll check off no, they don't want to talk. So this is why the screener is so important to use in conjunction with those bottom 3 questions. I mentioned students from this program learn what to do. They learn how to respond if especially a friend or a peer is showing possible signs. So acknowledging the signs that they're seeing, that the signs are serious, showing a friend that they care about them. And we talk to teens through this program that the C does not stand for counseling or counselor. Their job is not to be their friend's counselor. Their job is to let their friend know they care and want to help. But then the most important step is telling a trusted adult, either reporting on behalf of their friend, or the best scenario is when they can convince a friend to go and they can go with them to tell an adult. But the key is that an adult is told, and teens learn through this program the importance of telling. And through this program, we collect data from all our school partners, and generally about 16% of students going through the program will be flagged by that survey, and they'll get followed up with by school mental health staff. Usually about half of the students that are met with, so about 8% of the students going through the program, they're ultimately referred for some type of service, either something in the school, something in the community, and this also includes hospitalizations. So the goal of this program is to identify students proactively and get them linked to treatment and supports to prevent them from getting to the point of suicide. But certainly if someone is at imminent risk, the goal is to identify them and get them help immediately. And SOS can do that. So if you want to learn more about this program, if you want to learn more about our work, Elyssa'sMission.org has tons of resources. And if you have any questions, please reach out to me at Elyssa's mission, I'd be happy to talk to you and to give you more information about either SOS or to give more information about anything that was discussed today. Thank you so much for joining the presentation.